So we were just getting ready. Hi, everyone. We were just getting ready to get started. We're not officially starting yet. And I looked over and I saw that there were already 50 something people in the room. And I thought, oh my goodness, let's just open the door. Let's let them in and let them hear us talking. We were just talking about the fact that Jamal is responsible for our youth and young adult in the Commonwealth of Pennsylvania under the terms of our grant. And Todd was asking him to explain that a little bit. And I think that with Todd doing this international work, I don't know, maybe it makes Todd responsible for youth and young adults all over the world. I don't know. Maybe, maybe.
A lot of responsibility.
A lot of responsibility. I was also saying that we're going to be talking about some things that certainly open emotions for me. And I just want to warn everyone, you're going to be seeing tears from me, and it's all good. It's all good. And I'm very, very much excited about today. So we have 2 minutes before we can officially start. And because Todd's in London, that means it's what, noon plus 5 p.m.?
They say it's 5 o'clock somewhere. Yeah, it's 5 o'clock here.
Oh, so you could be having an alcoholic beverage at this point and it would be legal. Okay.
Yeah.
We should have thought about that. We could have had beers or something today. That would have been fun.
Responsible for all of the youth in the world, so I don't know
So we
if
wouldn't have had a mine too. Okay. So what did you have for lunch, Todd?
what did I have for lunch? I've been just, I eat sort of throughout the day, so I kept snacking, but I made myself a tofu wrap, a homemade tofu wrap with sweet potatoes and tofu and green onions, and then some toast with avocado, and a little bit of salt.
Oh, that sounds very healthy. My friend Todd and my dear, dear friend Gabby are now living in a vegan household. And so there's a part of me that's a little bit jealous because I know what great cooks they all are, including Todd. And I wouldn't mind having some of that food or being together with them to enjoy meals as we have in the past. Now I have to rethink anything I was going to have for lunch. I would be embarrassed to let you know what I was really thinking.
No judgment for anyone's lunch.
No judgments.
Hello to everyone. They're just waving to
To
say hello to everybody out there who's joining as you come into the room.
Oh, the number is people are still coming in the door.
Hmm.
Oh yes, thank you. Please, thank you, Jamal. Jamal's doing my job today. This is like really fun, and I'm supposed to remind people to do what Jamal just did, which is invite everybody to introduce yourself in the chat. Tell us a little bit about what you do, why you're here, um, and I particularly I love seeing this information and getting that kind of feedback from people. And I'm hoping that I'm going to see somebody that we know, that Todd and I know, um, as we move forward today. Um, woo! I almost hit the wrong button. So what do you think, Jamal? Shall we get started?
Sure, we most certainly can do that. As it is 12:01, we will allow everyone to kind of come on in. But until then, I'd like to welcome you all to our virtual speaker series for 2024. Today's webinar is Creative Health, Music as a Healing Tool at the intersection of songwriting, art, and storytelling and well-being, provided by the PA Care Partnership in association with the Office of Mental Health and Substance Abuse Services. better known as Sauce. I'd like to thank you all for joining us today. And I'm going to turn it over to Nancy.
Thank you, Jamal. As some of you, I know that there were a good group of people that were there as we were opening the doors earlier, and heard that Todd is a personal friend of mine, and so I'll be a little bit more active today in taking over some of Jamal's roles, and he will take over some of mine. And um, and so I'm excited to have Todd here. He is speaking to us from, what's the name of that suburb you're in?
I'm in Brentford right now.
Which is right outside of London. Yes, London in Great Britain.
It's the
And
west side of London.
the west side of London, not just any side, the west side. And and I am very excited to have him here. And we're going to talk about something that nobody is doing here in Pennsylvania because it's just new and happening in London. But first, I would like to start out with a question, and let's see who's in our chat and knows the answer. Who knows who Stephen Van Zandt is? Let's see. I can see.
I see
Well,
somebody throwing it in
on
there.
there fast enough. Oh my goodness. Jamal, do you see anybody who knows who Stephen Van Zandt is?
Hmm. I see Bruce's lead guitar and
E
actor.
Street Band, musician. Yes, yes, and more. Band member of the E Street Band. Yes, thank you, Bert. Guitarist. Yes, and gangster. Yes, yes. He played a role in The Sopranos. His character was Silvio Dante, and he is quite the character. And I saw him last night on television, and he said something that just, it just struck me. I thought, oh, this is like so perfect for today. I have to quote him. So Stephen Van Zandt tells us, we are the only country in the world that thinks art is a luxury. Everyone else understands that art is an essential part of life. Well, I personally agree with that. I know how much art means to me. When we talk about self care, that can mean going to a museum for me. And that can mean going to the ballet. And it can mean going to the Bach and hearing Todd and Gabby sing. Um, and so when I heard that, I thought that is so apropos of what we're discussing here today, and the work that Todd is doing. And Todd is an internationally known musician. He is a creative health practitioner, and he's a speaker. His most recent speaking gig was at Carnegie Hall in New York City just a couple weeks ago.
Hmm.
And Todd is here to talk to us about his work in what is called creative health in Great Britain. Creative health is a program of work that uses creative practices to support people with physical and mental health diagnoses. It embraces visual arts, performance arts, film, literature, music, crafts, gardening, heritage, and digital arts. Todd will discuss with us his co creation work using songwriting's empowering and healing ability with vulnerable populations in London. This presentation is a unique opportunity to find out about what is happening in Great Britain and what we can learn from how their health practitioners are incorporating creative health in their practices, and maybe do some of that here. Todd recently earned a master's in creative health at the University College London, in one of the first schools to offer it. It is the first degree of its kind in the world. I'm going to let Todd talk to you more about that, in our rapidly changing health, social care, and social impact fields. Todd is providing us with the opportunity to shape the future of healthcare, especially mental health, through the creative health field. Todd's field of art is music, and we will learn about music as a healing tool for those who work with people with a mental health diagnosis and for people who have a mental health diagnosis. His experience is working directly with families and providers. We will also hear some of the music he has written that is currently used as a healing tool. And Todd's collaborations are not just about music and the art of storytelling, they are also about co-creating art as a lifeline for those in difficult times, facilitating grief, joy, and flow. The songs he's creating with people are a tapestry of resilience, inspiring the kind of changes we need to ensure spaces for healing, to transform into places where people create, imagine, sing, and dance through their difficult stories. Running parallel to this work in his 20 plus years of performing, touring, and recording albums, found on all streaming platforms, and he has a soon to be released album called Good Grief coming out. I am deeply moved by Todd's work, and we are honored to have him with us today. Um, at which at which point here, I am going to turn over the floor to Todd. Welcome, Todd.
Hi, thank you, Nancy. Thank you, Jamal. I'm going to share with you my presentation here. So, um, hi everyone. I guess it's a little bit past noon. Might be a little bit of a different feeling than it is in London at a little bit past 5 p.m. I'm really excited to be sharing. What I'm going to be getting into today is sharing about my work through sharing about my life because they are intertwined. So my lived experience of this work is as an artist and as a curious person, as a man, as someone who is trying to be as present as possible for people in difficult situations, people who with whom music can be transformational, can be healing, can be a unique, beautiful experience. And I'd like to talk about some of what I've been studying with creative health this past year, talk share some music. So I'll have some songs to share from throughout the projects, I guess throughout the journey of becoming a creative health practitioner and becoming a community musician. So these are all terms I'll be sharing, community musician, creative health practitioner. They might not be terms that you're familiar with, so I'll try to give not definitions, but how these terms have played out in my life as we speak. But the first thing that I do when I am playing in the hospital, when I'm playing in a any kind of facility where I know I have to open people up, I usually start out with a song that was written. This was written in a dialysis ward. So this was in London, in a hospital in London, where I was wandering around the dialysis ward for children and asking kids if they wanted to write anything, if they had any songs, if they wanted to just be creative with me. And I wandered up to this one little girl and her family, and she was about 7 years old. And and I said, "Do you want to write a song with me?" And she said, I've got lots of songs," which was pretty amazing to hear. And this is while she's on dialysis. And I said, "Well, that's incredible. Let's see if we can work something out. But what are some of your songs? You know, can you sing me one?" And she said, "Yeah." And she started cracking up, and she sang me this song that she had just written, and it was about strawberries. And I loved it. It was a beautiful song, and I thought, okay, if I can only find the guitar part, and I worked it out right there, and we just started singing together, and I feel like the rest of the world melted away. You know, the dialysis that was happening, um, any kind of worries, you know, everything melted away into this moment of us singing this song that she had written. And it gives me a lot of joy to play it, and it also, I think, opens other people up. You know, how can you deny a 7-year-old's song? So it just starts like this. I'll sing maybe some of the rest of it later on, but it starts like this. So if you're at home, you can follow along. I'm going to play it a couple times. and sing to yourself, or wherever you are. Maybe you can just sing it out loud or hum it. It goes like this. They're red, they're sweet, they're very nice to eat. They grow under the soil. They're nice on their own, oh, with cream, full of vitamin C. All right, are you ready at home? They're red, they're sweet, they're very nice to eat. They grow under the soil. They're nice on their own, oh, with cream, full of vitamin C. So that was the beginning of what later became Strawberry Hope. So that was the Strawberry song, and I said, actually, her mother said, um, "Can we write about something that's hopeful? And how can we change this song or add something to it to make it hopeful?" And we added a little bit. Um, we started talking about what this could mean, like the tubes, and how is this connected to strawberries, and how is this connected to, how can we sing this to other people? And we started laughing because we started imagining that the blood from dialysis was just strawberry juice, right? And it was just coming from um, it was all just connected to strawberries. And we later wrote more lyrics uh, for to call it Strawberry Hope. And interestingly enough, I then took the song and I worked in a another ward with older adults on dialysis, and we added lyrics. So it became an intergenerational song in which these older adults on dialysis wrote the verses, and the chorus was written by this little girl. So it became this opportunity for these communities that had for this girl in children's hospital and in dialysis there, and then older adults in their dialysis to connect with each other. So it's just an example of how music and creativity can connect people in different spaces, and that's what we're doing right now, right? We are connecting through the internet over space. It's something we're getting used to. So I'm glad that maybe you sang at home and you're connecting with me creatively. So
Todd, let me just
yes,
interrupt you. So you said that you're wandering around a hospital with a guitar, and then you start talking to children. That sounds to me like something that somebody around here might want to dial 911 and get this guy out of there. So
okay,
how
yeah,
did you get into that hospital, and why didn't someone stop you?
right. Thank you for that. So I wasn't wondering. I was invited by Breathe Arts, Health, and Research, and they invited me to start doing a collaborative songwriting program, uh, and so that was in the beginning. I was just going into wards and trying to make connections um, before I later started creating one-on-one relationships. So in this, there was these children were connected for dialysis, and it wasn't really. Uh, it was a different situation in which I only had a couple of hours, and I kind of had to wander around that ward. So that was how that situation played out. I only had about 15 to 20 minutes with each child, and I could play and figure out either a poem or a song. But yeah, I was definitely invited uh, to go there. And I'll speak a little bit later about the another ward that I went to in that hospital. But I think I'll start in the beginning of how I got involved in this work. Um, so I was the reason I want to go through this sort of transformation from touring musician to community musician is because I think we don't always see the potential in what artists can do. We talk about the art, and we talk about the transformative capabilities and um, of art, and we don't always talk about the artist, and how does one move from someone who is just playing concerts in bars to working in hospitals. You know, what are the ways in which, what are the skills that you can learn, and how does this happen? So around 2010, I believe, my band had been playing. We've been touring around the United States. We've been playing in Philadelphia. We'd recorded a couple of albums, and we decided that, well, I kind of decided this. My band wasn't sure about it, but I kind of decided that this touring model wasn't always as fulfilling as it could be. You know, going from town to town, playing to an audience in the dark. You don't see anybody. You don't make any connections afterwards. Maybe you say hello to people, but there wasn't a connection to the community that I felt like music could really offer. So I presented to ASCAP, a music publishing company, and we came up with this idea of pairing us with America Scores, which was an after-school soccer and poetry program. And we were the first band to pair touring with working with students after school. So they would be writing original songs with us in their poetry program and then recording in a studio. So as we toured through Washington and Boston and Michigan and Chicago, Milwaukee, New York, we would stop in a local school and we would write a song over a 2-day period with them after school, and then go into the studio and record them. So what you're seeing here is pictures in New York. This is the album, Other Voices, Other Rooms. The Great Unknown was the band that I have played with forever, and Student Poets. So I would ask them a question, and they would free write, and we would just open up the room to their imaginations, and they would write these incredible responses to the questions that I felt would match the process of songwriting. You know, like, what do people write songs about? Well, and how does one write a song? You need to sort of mix all of these influences. What are you reading? What are you thinking about? What are you dreaming? What do you know about love? What do you know about the moon? You know, and I'd ask these questions, and these kids would come up with incredible responses. So then we traveled around meeting these kids, having these incredible experiences, and that became our tour. So we would play the shows, and we would also play with the kids, and we would meet their families. We would meet this incredible community as we passed through, and we just kept trying to change the model of how we were existing as musicians. So this was pictured here is Martha Reeves. I think some people out there might know Martha Reeves. Jamal, I see you shaking your head. Yeah. So we got to play at the Apollo with Martha Reeves. She sang one of the songs that we performed, and what a life highlight to play at the Apollo with a big group of children for a fundraiser. And this became, for me, I realized this is opening up another world of how to be a musician. I'm playing at the Apollo with a group of children and Martha Reeves. I'm touring and playing with after-school programs. This is not the life that I imagined as a touring artist, but it's something new, and it's something that I want more of. I want deeper meaning. So this is, I want to play a little video here of one of the little girls who was a part of the program. And this is a quote also from the Huffington Post that speaks a little bit when they wrote about our project. But let's hear.
Nice. So, write down the last dream that you remember. The world will have no thunder or snow when the internet's gone. We'll listen to the radio
attention, please, ladies and gentlemen. This is very important.
Listen to the radio. We sing sunset. And the fight is over. We see the sunset.
So in this song, I had asked them what was the last thing you learned in science class, and they started talking about decomposers and producers in the plant world, and somehow we got into this whole epic story of an apocalyptic world. So these kids were imagining, and I think a lot of children right now are imagining, what if all of this falls apart, right? What happens if things were to fall apart? Climate change, war, what is it? Whatever it is that happens. And the answers that we were getting were incredible. And it was, they were singing this world into existence without being afraid. And I think that's, they were brave, they were creating, they were imaginative, they were singing it together. And at this point, I wasn't studying what was happening with these kids. This was, 14 years ago. But can any of you imagine what this might have been like for children? What it could do for kids now, writing a song and thinking about the future, maybe engaging with what if things fell apart? What would we have? What resilience do we have? One of the lines that you heard there was, when the internet's gone, we'll listen to the radio. You can imagine that some kids may be thinking, if the internet were gone, all of life would end, but engaging with the possibilities of, we actually, underneath it all, we have resources. There are things that we can turn to, like our imagination, if everything falls apart. So this is another example. I'm gonna skip over this for now, but I'm gonna send you, maybe we can send links out later of some of these videos. But this was in Boston. We created a dance, we created a song. It was working with teenagers, so it was a little bit older. And each group we learned a little bit, something a little bit different. One of my friends recently, who has been working in refugee camps in Greece, we were talking about that and trying to figure out how we can keep pushing this songwriting work into different populations, and who is in the most need, and how do we work with those people. She works with teenagers in Greece in a refugee camp, right, for 8 years. And I said, well, what was that like? And she said, I got a PhD from the universe. That to me was a perfect idea of what the kind of skills you may need to engage a group of teenagers in that kind of situation. But she said it was also amazing, and people were singing at the top of their lungs. As they create these songs, they create ownership of something new and something that you can carry with you anywhere. And for refugees who don't have the ability to carry much anywhere, if anything, carrying a song becomes the thing that they have. So you can imagine how much release and pride and power comes in having something that you can carry anywhere. Here's a couple of quotes from some of the kids. It had been the best day ever. That's how sometimes kids can speak. The moon, we talked about the moon and love and dreams, science. And here it says the profound in the simplicity of their wisdom. And I think that's interesting because their wisdom is something that I think all wisdom has some sort of a simplicity to it. I think we tend to complicate things as we get older, but we understand things from a young age. Um, we understand the core of them. And writing songs with children, I've seen that. What's the core of what your thoughts are about science or about the world or about if things fall apart, about love? There was one kid who said to me, I said, what do you know about love? And he said, I know about love. Love is when you're in love. And it was simple, but it hits you. Love is when you're in love. You're in it. You're embodied by love. It's something that you're inside of. And that became the opening line to one of our songs together. So, are there any questions that are popping through? I'd like to pause before I move to Nashville. Yeah.
Todd, this question came through that I love this because I'm thinking the same thing, and it is, creative health. What can you talk about how creative health, which I know is a term that's used in Great Britain in the work that you do,
Mm-hmm.
um, and has um, therapeutic uses, and what's the difference between creative health and creative arts or creative art therapy, that sort of thing.
Mm-hmm. Well, creative health versus, creative therapy is all within the realm of creative health. So the realm of arts and health uh, is not new. We've been using arts in health for a long time in the world. I think what it is that we are now, in the last 10 years especially, finding evidence of how this works. For a long time, people have been getting together in communities and crafting and playing music and getting out into nature and doing yoga and writing creatively. And it's been something that people do in groups. They do it or they act together in theater companies. They do all of this um, because we understand that that is something that enhances our experience of living, which is something that we can say is what our well-being is. It's what is our experience of life, right? And art has been used forever as a tool to experience and understand and process our lives and heal as we're doing that. Now, in the last 10 years, especially here in the UK, there have been more and more studies around how does this work? So how do we understand the different contexts in which music, in which theater, in which cultural experiences, crafting, how do these things actually heal us in the times in which we need them? So studying that for me has meant learning how to research it. So in a bit, I'll start getting into how have I measured some of this, or how have I understood what is the impact of some of this. So this is all the beginning of how I sort of transformed from musician to community musician, and what are some of the skills. But then later on, I guess pretty soon I'll get into how do we research it. And when we start talking about something as creative health, we're thinking about some of the research and how we can measure it. How can we figure out how this is helping people's well-being or biophysical markers of how it's helping them? But also, what are some of the creative resources of a community? So, how can our communities be empowered to heal themselves? And I think that has been my draw to this work, is linking some of the ways in which communities can be empowered, can feel empowered, can use their strengths in times like the pandemic, or in times in which they need to feel together, to feel less isolated, to feel like they have some control over their own narrative. And that has been the I guess the definition for me of how creative health works. It's not, I can say what it's not as well. It's not a direct power relationship of we're just giving you this, more of a prescription of straight from doctor to patient. It's more collaborative. So a lot of this musical participatory art that I'm talking about, in which I'll go into a room and play music, create songs with people, is a way in which everyone's resources are used. Right? It's not a gift of one person to one person giving health to another, but it's how can we use creativity as a well to all draw from and experience the power that art and creativity has on our lives.
I was just reading some posts in the chat, and someone has mentioned being in a drumming circle
Hmm.
recently. And I've always loved a good drumming circle because there's a physicality to me and I can feel it like working in my body. And I also feel that way about all of the handwork that I do. That through the years, knitting, crocheting, all the things that I am a maker, the things that I make that help me to work through um, the issues I may be having, the stress of the day, all of those things. And I'm not. I can see where there. I'm still not seeing where there is. I think the big difference that I'm hearing you say is I can be by myself, and the creative arts will help me in my personal healing. But what you're talking about and what you're doing is, yes, that, but in a community setting, in collaboration with other people. And um, and would that be correct?
Yeah, I think it can happen in both ways. What I think we're trying to do within creative health, what I've found is getting people out and together, is and getting people out of isolation is one of the greatest things we can do for each other. Is that connection and that ability to do something creative with others, um, has an enormous effect on our health. So the way in which I've engaged as a creative health practitioner has always been either in community or in a collaboration. So even, just me and two parents or even one parent doing something together allows us to open up and allows us to start creating something we can be proud of, creating something that helps us process what we're going through, something that we can share. So it's a way to start connecting outwards instead of keeping everything processing inside. And that is at the core of my practice. Um, it's something that I've done starting, with those children. I think this is, I'm speaking. I'm moving to Nashville, working with, here pictured is working with refugees, Bhutanese refugees, and I was teaching English, and we would sing songs that were crafted to learn whatever the lesson was for English, and we would sing them and laugh, and it would disarm everyone towards the awkwardness of learning a new language, of getting things wrong, of struggling, in a new country. So what I'm trying to present here is the different contexts. This idea of getting together and singing, getting together and writing songs is one of the ways that we can be creative and reach out to one another and also explore our own creative resources as communities. So this is a community who we had very limited resources. We had a garage that we could go to, and in the garage we had, you know, it was kind of pieced together resources of what I could teach with. But I had a guitar, and that became incredibly useful to break through any barriers of awkwardness or of fear that adults had, um, of trying something new, of learning. Um, does that answer any of your questions, Nancy?
Yeah, and I want to make a comment here too. But one of the many reasons why I asked Todd to be with us today and to discuss his work is one of the things that I learned and was working with this past year as part of the PA Care Partnership Grant was hearing people in the different counties who are working, who are state employees, providers, whatever, who are working with people, our community of people who are looking for help, resources, supports for youth and young adults, mental health diagnosis. And one of the things that I found is that they would go to this place or that place where they were told they would be able to get help, only to discover that the help that they needed was not available in their county. And um, and I and it's heartbreaking to me when I hear these things. And then and then there's that part of me that jumps up and wants to say, okay, so what are we going to do about this? And one
Hmm.
of the things that I discovered about so many of the amazing people that are working in the Commonwealth of Pennsylvania as social workers and others is that they are finding ways, finding solutions, even when they know that what this person needs is not something that they can offer them at the moment. But in the meantime, they can do this or this or this or this. And I see this work, that we're talking about today as being within that category, so that there may not be a formal nonprofit that provides this support, but it would be easy enough in your community to have somebody who was some type of artist, whether it was any of the list of the creative arts that we were talking about, that could step in and work with youth and young adults and give them opportunities to express themselves in these ways. And I'm hoping that people who are listening today or see this webinar, watch the recording in the future, it gives them some ideas about how they might be able to support and provide for people in their community.
Yeah, excellently
I'll,
put.
I'll turn it
I
back to
think,
you, Todd.
yeah, well, I think working on top of that, there's some terms that are new that I'd like to introduce, such as social prescribing. You know what you're mentioning, it brings up social prescribing to me. This idea that of how do we build a plan for people who don't really match up with some of the other resources that are offered. Um, there is a new system here over the last maybe 5 to 10 years that's really started to blossom, called social prescribing. And it's actually happening, it's starting to happen in the United States as well, in which you have people creating a their own creative health plan, in a way, their own well-being plan, in which they connect with a link worker, which is somebody, it's sort of like a social worker, but it's not, it's a kind of a different job. Someone who is an expert in the community resources, who will then create a plan with that person. So it's not for that person. It's creating a plan with that person to find out what is in their community. How can they create a plan that matches the resources of their community to offer them what they may need? And that is different from creating a health plan and going to a hospital and saying to your GP, I need to be healed. It's more, what is going on in your life? and how can we figure out a way to use your community, the resources that are available there, whether they're arts or health related like yoga, um, or a running group or a crafting group. These, I think what intimidates some people is just trying to connect out to what's going on in your community. So having that person is a newer plan here, having that link worker. It's a new job that I think in the United States would be an interesting development to start happening, to start spreading. And there's socialprescribingusa.com is another one of these organizations that's really trying to push social prescribing as a way for people to actively engage with their community resources. So the kind of things that I'm doing, they're examples of community resource. I'm always working with an organization and offering these, exact like what you said before. I'm not just wandering around a hospital. There are organizations that are offering me as an artist to help people create a song, right? Or help people learn English, and I'm using song as a part of that. So I'm an example of not a link worker, but one of the artists who may be connected to someone who is looking to connect to the community. And I'm just giving you examples of how this art and this participatory music is a part of that healing, is a part of something that's universal for each community that I work with. Here I have working with young men in positive masculinity. It is it's fresh because I was just on a podcast last night called Talk Like a Man, and we were talking about these issues of masculinity and music and how isolating it can be to be socialized to not really speak about what you're going through for men. And what I found with song, with music, with creating with young men, and this pictured here on the left side of the screen is a young man from Guatemala who was working in a garden with me. I was working in a neighborhood organization, and we were learning English in the garden. And that's there. I would use music. We would sing about the garden. We would, practice gardening techniques. I was a gardener at that point, and that's all examples of creative health. It's not just music. It's being outside, being in nature, gardening as a community resource. And he found a real community there doing that. Pictured on the right here, I was working in Renton Technical College in computers, and so with students who were learning network technology, and also with young men who were learning to be automotive engineers. And what I found was that in those situations, having a guitar, but also being connected to different creative modes of expression, brought a whole new way of letting themselves out in front of each other, letting out vulnerability. And I remember very clearly one moment of seeing one of my students upset, and the relationship that we built, that I was the sort of sensitive musician in the class where people were socialized to be tough, and I walked over to him. I knew he was not doing so well, and I just put a hand on his shoulder, and he started crying. And I said, "Do you need to take a walk?" And he said, "Yes, I just need to take a walk." And I think about that sometimes in these kinds of in all of my interactions with music, is sometimes people need to take a walk. Sometimes somebody needs to be witnessed. Sometimes people need to write a song. But this is all a different kind of resource than is offered when, other than somebody just going to the hospital or going to the doctor. It's a creative resource. So I'll skip through music for my own well-being and the pandemic. I mean, I don't want to skip through the pandemic because we were just speaking about that before we went on. Nancy was talking about how important one of my songs felt. And I was processing, just to mention quickly that I use music as well to process what's going on. So during the pandemic, um, that's what I had. It was my own resource. This is me pictured with a big beard. That's a pandemic beard. But it was my own resource. So looking out and seeing what was so strange and new, this world shut in. How can I process this? And there's little Todd crying down at the bottom there. How can I process all of this with music? Um, and I wrote a song about the fireworks that were happening every night and how we need a release. Um, that's in my own music. You can check that out. Nancy, do you have anything to say about that? We were just talking about it.
Uh, in- I would just add that that was something that was happening here in Philadelphia, and so the first time I heard the song, it I could hear the fireworks outside my window, and it brought back the emotions of that time. Um, and I know what it was like for me, but I also know that everyone had their own experience, had their own issues, and that it was a painful time. And I was sharing a story about one of my friends whose 5-year old had had made best friends with the little boy next door, and he would come running over and he would knock on the door, and she would open the door, and the two of them would play together, and they would go back and forth between the two houses. And when lockdown started, they made the decision, that they were going to isolate themselves. And the little boy came to the door, and she couldn't open the door for him. And he stood there and he cried and he knocked on the window. And for a while, they talked through the window. And I can only imagine what that did to these kids and what they're taking with them into their life. And so many experiences like that we've heard about. What can we do for them? How can we help them? And um, and I know that your music has been a powerful um, healing tool for me.
Well, I'm glad. That's what I hope for. So during the pandemic, um, I felt like I had had a lifetime to sort of prepare for this moment, um, of sharing music, of creating music with people in this situation. And uh, I found a job on a job board, on an artist job board, uh, calling for musicians who could co-write songs with people in Carnegie Hall's Lullaby Project, an international lullaby project. So this was a project in which throughout, I think, 45 countries, people are right now, and for the last 12 years, I believe, um, writing songs in collaborations with artists, for their family. So, um, what I started to learn this new process is, how do I write a song? What is the story that people want to tell? How do you write a song with someone who's never written a song before? And this became the core of my practice for the last 5 years, is writing a song with people, figuring out what is the core of their story, as a parent, in these situations. So a lullaby, you may be thinking, a lullaby might be a classic song, but to write an original lullaby, something that you can share, that is the core of your story, something that you want to pass along to your kids, to your whole family. Maybe you can imagine your child singing this song when they grow older, something that they carry with them, maybe that they add lyrics to as they get older and sing to their children. This is the core of this project. And I want to share a song that I think it was one of the first ones that I did, in which this mother was sharing, um, really in her story some really difficult times that she'd had, as well as the joy that she had for her child. And that to me showed me the power of what you can do in a song. If you've never written a song before, and then all of a sudden, if you're witnessed, if you're you have somebody there who is just validating your story, you can sing into life this song of resilience, this story, this beautiful thing to share with your whole family. So I'm going to play a little bit of that.
I'm almost tired, but no matter how tired I am, with you in the morning, I get a rush of happiness, so bright, even with the blinds closed. You're the reason I smile, you're the reason I breathe, you're the reason I work hard. You're the reason I wake up in the morning, baby boy. You bring me so much joy. I want you to know you're royalty, a king to me.
All right, I'll pause there. That's Bethlehem. She's a local Philadelphian musician. Um, yeah, and this was pictured over here to the right was us right before the pandemic, all gathering together, learning some of the skills of becoming a lullaby artist. The other thing that music and participatory music, especially in lullaby, brings is this connection out to language, culture, ancestors, nature, all of those things. When we talk about creative health, we're tying in all of those aspects that can increase our well-being, that can make us experience our lives on all levels with joy, and connect our for this one family, it was connecting their experience of raising a family to back to Mexico, where they're from, and living here in Pennsylvania. So how can they write a song that reaches back to their culture, that reaches into nature, where their son is looking out and experiencing this fascination with nature as a baby, and they talk about it here, and I want to share that.
We love to sing to Leo, and we were really hoping to have a song in both English and Spanish.
So we can sing it together. We're raising him bilingual, and it's hard to find songs in English and Spanish. I try to only speak in Spanish. She's always speaking in English, and it's hard to find them.
Yeah, so it was really important for us to have that part. And then when we were coming up with ideas for the lyrics of the song, we shared a story about this bird, this red bird, that's always outside our house, it's always outside our window. And this bird for us, it just became like this constant reminder of home and our loved ones.
Yeah, more specifically my grandmother and Abby, that we wanted him to remember her with this song, and remember that you're supposed to be happy every single time.
We love the song. We sing it all the time.
I love how it ended up, because when he's home in the house, he's also reminding the other home, and both are our homes, and we need him to remember that.
So I'm going to pause it for any questions that are going on in the chat, or anything you have from you,
This
Jamal. Or
really great question here from Sunday, and she's asking, what is the impact on adult versus children? Are there differences in the levels of acceptance and participation?
That is a great question. For me, as a practitioner, I can say children are easier to reach right away. They are dying to get involved. If I walk into a classroom, or most situations with children, it's pretty easy to get them to start singing, or just the energy is right there. A lot of adults have some, you would think, have some barriers up towards singing, towards participating. They think as we get older, we start creating this narrative of I'm not an artist. I'm not. I'm not. This happens very often. Oh, I'm not creative. I don't make music. This is going to be something that you do for me, right? And that doesn't happen as much with children, but with adults, there's this barrier. And there's been some studies around our artist identity and what happens when we're younger, when we start creating, and someone tells us that it's not good, or we tell ourselves that it's not good. And how does that lead to later life, where we shut down a part of ourselves, our creativity, to say this narrative of I'm not good enough, or I can't do that because I'm not an artist. And what is important for in this work is to open up this possibility for adults to do what children do naturally, which is just to jump in, and not to think with your inner critic, not to think, what can't I do, but just jump in and start making art, start being creative, make your story, make a song, make a craft, without having something that shuts you down. So it's been interesting figuring out how to disarm people from that inner critic, separate them from that, so that they can be like children again and just start participating, just start making art. Does that sort of answer that question, perhaps?
I think that sounds great. No, I love that, Todd. I love that. Thank you.
Yeah.
Jamal, this might be a good, I mean, you haven't said a word at all, which is so unlike you.
Yeah, it is very much unlike me. But I'm also paying a really close attention to the time, and I know Todd has some very important slides that I feel that he needs to get through. I've actually found at least 3 to 4 really important questions that are also in the chat. But I wanted Todd to get through Tones of Home before I started to kind of ask those questions and really talk about what he's doing right now.
Okay, that's great. Thanks, Jamal. We'll do that.
So I'll jump in. So as I mentioned, or as Nancy mentioned as well, I went to school after the Lullaby Project. I guess during the Lullaby Project, I fell in love with a British woman, Gabby, and I also decided that we were going to join her and move to England, and I wanted to find a way to deepen the study, deepen the understanding of what I was already doing. For me, that's how I kind of live life: is what am I already doing, and how can I deepen it? How can I get better at it? How can I understand it more? And I found this program of creative health as a master's of science, a master's of arts and science. So at UCL here in London, and I decided to study what I was doing. So study this participatory music, collaborations in music. And I got the opportunity to work with an organization called Live Music Now. And they asked me, actually not knowing, they knew me as a practitioner. They didn't know that I would be studying this, but they asked me if I could work with parents of autistic children or children who were on the pathway to diagnosis. And I jumped at that opportunity because I thought this was a perfect opportunity for parents to process and incorporate what's happening in their life when they're receiving a diagnosis or when they're awaiting and they're processing what's happening. They notice that something is different about their child and how they learn or how they process, and they're trying to figure this all out and attune as a family. And during that time, this is for me a perfect time to bring in something from the creative health field, for them to express, find what their story is, find what their story of resilience is, find what their story of love is, and share it because this can be a really hard time. So, but the love is there, you know. So whatever a doctor tells you, if they diagnose and they say your son or your daughter is autistic, it doesn't change the fact that you just love them, right? And that love, to just sing about that love and write about it and share that with your family and share that with your community is incredibly important. And it's not an opportunity that everyone has, especially during that time of diagnosis and of thinking and of trying to understand what a diagnosis means. So I got to run a program just like the Lullaby Project in a lot of ways, 5 weeks with 2 primary schools, and met with parents in a coffee meetup group. So they already had this meetup group after school, and the parents, I talked to them about the process of writing songs. Some of them were scared. They said, "Oh, I'm not sure if I can do that." But a lot of them said, "Yes, my kid is already interested in music. My kid loves music, and I need to use that as a way to communicate with them, use that as a language." Because a lot of these kids were nonverbal, and music became the language in which they could communicate. So I have a song here. Do we have time to play just maybe a clip of it?
Yeah,
Yeah.
go for it.
Okay, I'm gonna play a little clip of the song. And this is a mother who has a son who is nonverbal, who she's crazy about. And she has been seeing the world through his eyes, watching him and just loving him. And she had never written a song before. This is her first song, and she was incredibly surprised at the process. And I think and involved her whole family in the song. So it's become something that she's shared out, and her whole family now has. You'll hear in there all of this. Let's see.
My precious son Mason, you are loved, you are wonderful, you are worthy. Keep smiling, keep shining, I'll never be anything but you.
This is where I'm at as a mother. Everything in my power. Talking to myself every morning. Finding courage for the long run. I can't sit back. Yeah, I know it's understanding how growing up, everything as a whole, the family, and when we're older, little changes, little steps, a long way to go. Little changes, little steps, no matter what, love, no matter what, love, no matter what.
Then you made me so proud to be your father, and I love you.
I'm learning living through his eyes. I wouldn't have thought of it that way.
so much for one spot.
It's beautiful to see two can shine differently.
Dear my brother Mason, you are the most intelligent and loving boy I've ever seen. I'm so lucky to have a brother just like you.
Little changes, little steps, we've come a long way. Little changes, little steps, no matter what love, love, no matter what, no matter what love, love, no matter what.
Okay, I'm going to stop it there for now. It's a beautiful example of a parent gathering their resources and sharing all of that in a song, condensing it all, and then involving.
Todd, I'm having trouble hearing you.
Oh, uh-oh. Can you not hear me?
Are you having trouble, Jamal, or is it just me?
No, I think I'm good.
Oh, okay.
Okay, now it's better.
Okay, good. Yeah. So she was one mother, and there were six parents who joined and one grandparent. So a good opportunity for mother and grandmother to sing a song. There were three musicians, and I was researching the project. It was what I wanted to offer here was this an outlet, a way to be a way for parents to feel empowered during a time in which some of the power, it could feel like power is being taken away from you if you're receiving a diagnosis, if someone's telling you about your child, saying what are the things that I know about my kid, what are the ways in which I love. When I say participatory, I guess I've been saying that throughout this presentation. It means to foster an equal relationship between parent and musician and a collaboration working with both sides' strengths. So that was the goal. And there are ways of, I can imagine how I could measure that, but really the best way was just to ask them. And I interviewed the parents afterwards and gained a real understanding of what some of the benefits of this project can be. Why is songwriting important? Why do this kind of program and instead of crafting or yoga? Some people will say, "Oh, is creative health? What's the difference? If you do one thing or another." For me, as a musician, I can only present, the way in which I interact with creative health and what's important about a song. And about them creating this song, a lullaby, is that it's a part of their everyday life. So for these parents, the movement from throughout the day, it can be really important to have a song that helps move through the activities of the day, especially with a child who is autistic or neurodivergent, that it becomes even more important to have a song that helps you throughout the day to use for these different activities, as well as for their own parents' stress. So a lot of these parents were under a lot of stress, and this song was proving to be an incredible stress relief. So this is how it works. In this project, we had a letter or a conversation in one session. Each session was an hour, and we had a community music session because the idea was to make people feel a little bit less isolated and share their resources. So what's happening for you? And we all got together and we talked about what was happening in the sessions. And then we recorded the songs, and this is all on Zoom. So it's pretty incredible that we could do this from people's homes. The idea of calling it Tones of Home was that they were capturing sounds from home. What are the voices from home? They had, some people had recordings of rainstorms, of their dogs, of, birds that were outside in the trees. So it's capturing the sounds of home and putting them into a recording. And then we all celebrated those songs together. So that was a way in which people could feel proud. Um, I've got some quotes here. One person was saying this is why she joined, because her daughter just loved singing. Maybe she could help her. Um, uh, One important part of this process is flow. So getting people, when we're talking about this is the research side of things, is that creative health. One of the main benefits is getting into flow. So in this period in which you're just creating, and what I mentioned earlier is the rest of the world sort of melts into the background. This is where a lot of the well-being benefits hit, and there's a lot of studies around that. One of the mothers said, we were on fire that day for the hour session. And once we were finished, I was more excited about the next session. And she thought it was such an amazing project and she couldn't wait to see it finished. And this lasted for 5 weeks of her thinking of herself as a songwriter and starting to get more and more excited about these moments where she could just create. That's a beautiful thing to offer, especially in the period that she was in life, in which I was calling these family songs and community songs. Um, yeah, I can sort of skip through some of this because I can share some of this research. If any of you wanted to get in touch with me, I have a dissertation in which you can go as deep as you want with the research behind how this works, how songwriting, how creating a song that encapsulates your story can be so important to well-being for the parents and for the family. Yeah, I'm mindful of time, and I want to leave a little bit of time for questions. But these are some of the charts that I created as I researched, thinking about the impact and how accomplishments and self-esteem and pride and empowerment are something that we can't necessarily measure that in people's bodies, but we're measuring them in what people are saying about their experiences in these projects. If these parents are feeling empowered, they're feeling like they have an artistic voice, something that a lot of us take away from ourselves as we become adults. If their artistic voice is awakened, if they feel like they have an accomplishment as a parent, their self-esteem is raised, they're proud enough to be sharing this out to their whole family. Some parents shared this out on social media, and we're incredibly surprised to find that all of these people were so proud of their kid. If you can imagine what benefits that might have, we don't necessarily need to measure that quantitatively to understand the benefits that could have in a family in that situation. But I want to open up to some questions and start having a little bit of a conversation. I know I can't go directly back and forth, but I want to know what you all out there are thinking as you listen to this. And if you're wondering how this works or you have some sort of questions for me, I'd like to know.
Yeah,
I'm We're going to turn this over to Jamal, but Todd, I think this would be a good time to step away from PowerPoint and let's go full face as you're talking to people.
Sure.
There you go.
So going back to some questions, and I would like, if you do have questions, we don't have a whole lot of time left, but if you could place them in the Q&A, that would be great. It helps me to keep track of the questions. I was trying to mark the spot and where at the time in which I saw this question. So scrolling back to about 12:30 in the chat, there was a question about would you consider the Clowns Without Borders? And I'm not sure if you're familiar. I did a quick search on Clowns Without Borders when I saw the question, but would you consider that to be a creative health program?
I'd have to learn more about Clowns Without Borders. It sounds cool.
It's essentially a clown group, and they go around, and it, from what I gathered, very briefly, they use their talent to get people to engage in a way that's artistic and sort of it sounds very similar to what it is that you're doing, but using clowns and using laughter and comedy. It was one of those things that struck me because clowns are one of those things that it can be a phobia for people.
Yeah,
So
I know that very well.
right. So it was one of those things. I was like, "Oh, this is it's a thing," but apparently it is a thing where they do go around and use what it is that they do to help people and inspire people to be more artistic and things of that nature. So,
So I think yes, yeah, of course. Why not? That sounds very creative, and and I think that reminds me. It makes me think of what is some of the future. What is some of the vision of what we can imagine for creative health as a part of our ecosystem of health,
mm,
right? So if we're thinking about how can we transform a hospital to make it a creative health hospital? How can we transform a hospital to make it a space for healing in more than just one way? Right? What I've seen recently. So I work in the last 8 months. I've been working in um, the neonatal unit of a hospital, and I see parents sitting there in the most stressful situation you can imagine. You're sitting by the bedside and watching, and there's a beeping noise, and the beeps go faster and they go slower, and people's footsteps are faster and slower, nurses and doctors in relation to those beeps.
mhm,
And these parents are sitting by the bedside and they are not doing a lot. They're just sitting there. A lot of them are on their phones or sometimes crying or speaking on the phone with somebody in their family. And to go there and play music for folks in that situation, and then sometimes say, "Hey, let's go to another room for a minute for 45 minutes." They're there for 12 hours sometimes, and for up to 8 months to a year sometimes. As their child grows, and they hope that they can bring them home. To do that allows for this other space to happen, for a creative space. And as we start playing those songs, other parents sometimes hear those songs and they say, "Can you come over to us? And can we do that?" And so this ecosystem is starting to be created. And then at one point, the nurses started singing the songs that the parents were writing. And then we involved the nurses in singing the songs, these original songs on the recordings. So this whole ecosystem of creativity, of another identity of the parents other than the person who's just sitting by the bed, the staff started seeing them as these are these are humans with emotions and creativity and imagination, and let's all start to collaborate together. And that's what I imagine in a hospital. It can be music, it can be clowns, it can be theater, it can be dance. All of those things are starting to happen here in the UK. In the hospitals that I've been in, I've started to see some of these performances and dancers and um, musicians, and now I'm starting the songwriting. So I imagine that to be an ecosystem of creative health that runs together with the other systems of health, so that you have healing from creativity and you have healing from medicine, all in the same place.
yeah, that's awesome. And I agree. I think the arts are very healing. And there are ways to use them to help those who, whatever, for mental health, for substance abuse, for um, traumatized people. I think the arts can be a very healing place. But I think it's a lot like you said, where especially as we grow older, we kind of we shy away from the things that we consider ourselves not good at, right? So it can be a little bit more difficult, especially when you're dealing with older people who have an awareness of what they think, that what they perceive their talents to be, or what they've told their talents are, things of that nature. So um which it leads into sort of the next question that came from Karen. Um, what are the nuts and bolts of using music therapy in the recovery of substance abuse? And I know that's probably a deep question for 8 minutes left in the program, but that's what she was looking for. What are the nuts and bolts of using music therapy and specifically recovery of substance abuse?
I have not worked in that context yet,
Mhm.
um, but I can say, there are resources online to figuring that out. But one thing I recognize there is music therapy and using the terms music therapy. So I think it's interesting. Most people will see what I'm doing in the hospital or anywhere and say, "This is Todd, the music therapist." And I'm actually not a music therapist. So I do. I'm a teaching artist. Of what they say here in the U or there in the U.S. is teaching artist or a creative health practitioner, but I'm not trained as a music therapist, and there is a difference there um, between music therapist and participatory artist. And what I do is really engaging people with music and with songwriting and do a collaboration. So it's not as much that I'm trained to sort of heal everyone, but more I want to collaborate. So I'm
Mhm.
always creating an atmosphere in which everyone is participating. And that's what I really want to do. And I feel like in any situation with creative health, if you empower people and you give them a chance to express themselves, then that's going to allow for that healing to occur, and there's aspects of flow, there's aspects of storytelling, just singing is
Mhm.
amazing for your well-being, um, and of writing your story and sharing it and the pride that comes with that. So I haven't worked in addiction, but more recently, I'm working with adults with mental health issues, chronic mental health issues, and I can share just one quick story about that because it just happened,
Mhm.
uh, which was um, I was getting really low participation meaning the numbers.
Mhm.
There weren't as many people coming as we would have liked, um, and I just thought. I know they're up there in their rooms. I was playing in this living room and they were up there. And I think the real key for some of these programs is we know the studies, we know that music helps, that people singing, getting together and singing helps. So how can I get them down, from their rooms to come and play? And this one guy, well, one of the answers is food. So we started bringing in pizza, and and this one guy came down and he hadn't really participated before. And um, I'm so glad I made it down here. And I said, well, what made you come down this time? And he said, well, I've been up in my room every week listening, and I haven't been able to come down. I've been so afraid of coming down and being with everyone. And I said, well, what changed? And he said, I had enough. I had enough of being on my own. I had enough of being isolated. I just had enough of that. And I said, how do we sing that? And he started singing that. I started playing some blues, and he started singing that. I had enough, and it became this blues song that I mean, his soul opened up. It was like a portal, and he was dancing and smiling and laughing, and that to me was this perfect example of someone who's just coming out of that shell in his room, isolated, and downstairs and singing. And he's one of a few people that I've started working with where I can see it's one at a time. It's you can't when and I think that's something advice I can give to people is not always thinking about this as immediately when you offer a program like this, everyone is going to come down and everyone's going to join in, and it's going to be like awakenings where everyone is just whoa, pure joy. It sometimes it takes time. And what I hope for in the creative health world is, and in the health world in general, is that we start funding long-term projects. So one of the challenges that I want to share is that a lot of these projects are pilot because people say, "Oh, we're not sure, we kind of want to check out how it's going."
Yeah.
But to open people up and to, people who are experiencing either chronic mental health issues or addiction or, they're just in a really hard situation, to build that community, to open people up, to build a program and to get it right takes time. And it happens slowly and it happens one person at a time. But it starts to snowball and it's incredible what starts to happen as people witness each other. And I want to, share that because that the experience I've been having is people will try this, it'll get funded for, 5, 6 months or even less, sometimes a couple of months, and then, well, okay, we tried it, but
Right.
it takes time to develop this other system, you
Yeah.
know, and really have it start to merge and have people get used to it. So that's something I wanted to share. Yeah. Any other questions out there floating?
And listen, and I appreciate that thought. Um, and I also, there was something that you wrote on one of your slides that I wanted to throw in there also. Because when you're thinking about this, when you're using it for trauma or mental health or substance abuse, why is songwriting important? And that very last bullet point that you put there, songs prove to be a beautiful and easy way to share the difficult story of caregiving with other families in a unique position to understand and build community. And I feel like if you just changed any of those words in there, songs prove to be a beautiful and easy way to share the difficult story of substance abuse, of
Yeah.
trauma, of mental health, of any, you can just put those words right in there. And I think it would apply just as easily. So um, with that, we are at 129
Yeah.
and I thank you. There's so much here. I just
Yeah,
want
there's a lot to
to
talk about.
yeah, there's so much here that we can still talk about, and I actually have a thought that I want to talk with Nancy about after this, but I want to turn it back over to Nancy so she can close us out. This was very impactful for me, Ty, and I'm going to thank you for being with us today.
Thank you for having me. It's been great.
Thank you, Jamal. I I want to thank you too, Todd. I think I did. I just want to make sure everybody heard that my dear and wonderful friend Gabby is the woman that took him off to London. And I miss her every day. She used to live down the street. And I'm so proud that I've had them in both you and Gabby in my life. I love what you continue to do with your work. That you said, yes, I love this woman. I'm going to go to London, and now look at what you're doing, and that it's just you are a model for us all, and I thank you for that, and um, and I thank you for taking the time out of your crazy schedule to find time for us today. It's meant a lot to all of us. I've put some links in the chat about upcoming webinars, about please be sure and complete the eval, and all that stuff. If you've ever been to one of my webinars, you've seen before. And if you need anything, y'all know how to get in touch with me. Just reach out. Um, and
And me
thank you.
too. If you want to reach out to me, let's talk.
Yeah, I put Todd's and I can do, why don't I just do that one more time? Todd, I put the link to your website and I put the link
Great.
to your email account so that people can reach out to you. I did that several times, during the webinar, and and I hope they do, and maybe even hire you. Who knows? Who knows?
Yeah, thanks. I'd love to talk to anybody about this work. I obviously feel really passionate about it, and thank you guys for including this idea and this work and trying to hopefully inspire people to bring it to their own practices all around Pennsylvania, where I'm from. It would be an incredible honor to be a part of that, of spreading creative health throughout Pennsylvania, and I'm sure that discussion has been started already, and just being a part of it and helping a lot of people. And as you said, you plug it into any story, any difficult story,
Mhm.
and you can see what happens when people start lighting up. So yeah, thank you for having me.
I was just going to say, Todd, as I'm reading through the comments that people are making, I know that I met Michael, that I got people thinking, and they're thinking about ways that they can incorporate creative health into their work, and so I'm grateful for that. Thank you, everyone.